Hi, I am Dr. Saqib Mansoor, and I'm talking to you from my channel Learning Anatomy. And as you know, I started you a series of lectures on spinal cord, and this is in addition to that, the blood supply of the spinal cord. That's a comprehensive discussion. So, arteries of the spinal cord. Spinal cord is supplied by three small arteries, two posterior spinal arteries, and one anterior spinal artery. Here you see these are the two posterior spinal arteries, right? So this is one anterior spinal artery, right? This is a posterior aspect of the spinal cord. And you see these are running longitudinally. And they are reinforced by small segmentally arranged arteries, right? Segmental arteries, they are called, which take origin from arteries outside the vertebral column and make an entry into the vertebral canal through the intervertebral foramina, right? So I will show you these segmental arteries separately in a separate picture. These arteries anastomose on the surface of the spinal cord, and branches are sent into the substance of the white and gray matter. There is a lot of variation in the size and segmental levels at which these reinforcing arteries arise. And the need of this reinforcement is very obvious, as these anterior spinal artery and these two posterior spinal arteries are very small in size. So here you see this. This is the basilar artery and this is the vertebral artery. These two vertebral arteries form the basilar arteries. Vertebral artery take its origin from in the subclavian artery, and this is the anterior spinal artery formed by the union of the two arteries coming from these vertebral arteries, each one coming from the vertebral artery and making this one anterior spinal artery. So there's anterior spinal artery is one lying in the anterior median fissure, and the posterior spinal arteries are two. They come from mostly from the directly from this vertebral artery, right? And I told you already they're longitudinally. So here I have put into words the same discussion. So this posterior spinal artery can directly come from vertebral artery, or indirectly from pica, posterior inferior cerebellar artery, which also is a branch of the vertebral artery. So that I told you already, posterior spinal arteries supply the posterior 1/3 of the spinal cord, right? Posterior 1/3. That I will elaborate more clearly in the discussion on the clinicals. Posterior spinal arteries are small sized in the upper thoracic region, and thus T1 to T3 segments of the spinal cord are especially vulnerable to the ischemia when the radicular or segmental arteries in this region are occluded. So the anterior spinal artery, as I told you already, these are formed by the union of the two arteries, each of which take origin from the vertebral artery inside the skull. The vertebral artery then goes down on the anterior surface of the spinal cord, lying inside the anterior median fissure, right? This I told you already. Branches from anterior spinal artery make an entry into the substance of the cord and supply anterior 2/3 of the spinal cord. This is a single artery, but this supplies the anterior, right, 2/3 of the cord. In upper thoracic and lower thoracic segments of the spinal cord, the anterior spinal artery can be very small. And here the blood supply is mainly from the segmental arteries, right? And one artery is very important, greater in size, and I will discuss later, right? So this area, the cervical area is mostly supplied by the anterior and posterior spinal arteries. And below that, segmental arteries are mostly responsible for the blood supply. And the area at the junction of where the cervical level ends and the thoracic level starts is the watershed area. It's a name given to that, watershed area of the spinal cord blood supply. If the radicular or segmental arteries are occluded in these regions, the T4 and L1 segments of the spinal cord are especially particularly vulnerable to ischemic necrosis. That is clinically very important. That I will tell you later on more elaborately. So here you see, this is the posterior spinal artery, and this is the anterior spinal artery lying in the anterior median fissure, right? And branches are being sent into the substance of the cord, spinal cord, right? And these are the segmental spinal artery. They vary in size and shape and coming from a different artery. So origin is different at each and every level of the spinal cord, and they make an entry into the spinal cord through the intervertebral foramen. Here you also note these posterior radicular artery and the anterior radicular artery. I will tell you later on. So the segmental spinal arteries, here you see these are various segments and various arteries labeled accordingly. At each and every intervertebral foramen, longitudinally running anterior and posterior spinal arteries are reinforced by small segmental arteries on both sides. These arteries are branches of arteries that lie outside the vertebral column at that very particular level. So here you see these are the deep cervical artery, right? Here you see deep cervical artery. Then also these coming from these are the segmental arteries coming from deep cervical arteries. Then here you go down and there would be the intercostal arteries, like here, posterior intercostal arteries, right? And then the lumbar arteries. Here you see lumbar artery, branch of the aorta, and the sacral arteries, right? So they give at each level the segmental arteries. When each of the segmental spinal artery has entered the spinal canal, it produces anterior and posterior radicular arteries which accompany anterior and posterior nerve roots to spinal cord. I showed you the picture. Here you see again, right? This is, this is the segmental artery, and this is the anterior radicular artery making an entry into the spinal cord via the anterior nerve root along with that. And here is the posterior radicular artery going to the posterior nerve root that way. And additional feeder arteries, the word is feeder arteries, also make entry into the vertebral canal and anastomose with anterior and posterior spinal arteries, though the size and number of these arteries vary markedly from individual to individual. So very important, this great anterior medullary artery of Adamkiewicz, right? It's a German name, Adamkiewicz, also called great ventral radicular artery or Arteria radicularis magna, is one feeder artery that is quite large and important. Takes origin from aorta, direct branch from aorta in lower thoracic or upper lumbar vertebral levels, thoracolumbar level, you can say, right? So is unilateral. It's only on one side. So mostly on the left side. It takes a characteristic hairpin turn in its course. Here you see, here it is the hairpin. So now I have to zoom this picture. Here you see, this is the Arteria radicularis magna, various names, Artery of Adamkiewicz. Yes, here it's coming from aorta, and it takes a characteristic hairpin turn, this here, entering into the spinal cord, right? This is a feeder artery, additional. So importance of this artery lies in the fact that it is the main source of blood to the lower 2/3 of the spinal cord. Here the blood supply from the anterior and posterior spinal artery is very sparse or less. So another term, Arterial Vasoocrona, right? You see, first spot it out. This is the Arterial Vasoocrona. This you see along the border of the spinal cord. What is that? Anterior and posterior spinal arteries are connected by pial anastomosis, called the arterial, basically, this is a Vasoocrona, which encircles the cord and supplies the peripheral lateral part of the spinal cord. It also sends branches into the substance of the cord. Here's the branches going into the substance of the cord, right? So you see, I know enlarged picture as well. Just zooming. Here it is zoomed, right? So you see here, this is the Vasoocrona arterial. Here, this area shaded this color. This is the area supplied by this arterial Vasoocrona, and it says sends branches into the substance of the cord, right? So the peripheral part of the spinal cord is supplied by this Vasoocrona, right? And now you identify these are, this is a line, right? This I've drawn for you here. And the area anterior to that, right? It is supplied by the anterior spinal arteries, right? Which is a single anterior spinal artery. And this small area, relatively small, this is 2/3, anterior 2/3 supplied by anterior spinal artery, and the posterior 1/3 supplied by the two posterior spinal arteries, right? This area here you go, right? Okay. So the intrinsic blood supply, few words about that. This inside the substance of the cord, greater part of the cross-sectional area of the spinal cord, roughly the anterior 2/3, obtains its blood supply by branches from the anterior spinal artery. I discussed it already. This is the written. So these branches make entrance to the anterior median fissure and so are called sulcal branches. Other sulcal branches pass to the right and left side of the cross section of the cord. They supply the anterior and lateral gray columns and central gray matter. Besides that, they supply the anterior and lateral funicula. The remaining posterior 1/3 of the spinal cord obtains its supply by the posterior spinal arteries. Branches from the arterial Vasoocrona also supply the cord. Here you see, this is the intrinsic blood supply. So now the venous drainage, veins of the spinal cord, right? You can see 1, 2, 3, 4, 5, 6, 6. So these are veins of the spinal cord drain into 6 tortuous longitudinal channels. They are also longitudinal, which communicate above within the skull with veins of the brain and the venous sinuses, the dural venous sinuses. So what are they? Number 1 and 2, these are two median longitudinal channels, one in anterior median fissure. This is named as the anteromedial longitudinal venous channel. And posteriorly is a posteromedial longitudinal venous channel. This is in the posteromedian sulcus. And the paired anterolateral channels. These are the anterolateral channels, anterolateral longitudinal venous channels, right? They lie posterior to the anterior nerve roots, right? There the anterior nerve roots would be entering and they lie anterior to that. Paired posterolateral channels. Here, these are the posterolateral channels, one on each side of the posterior to the posterior nerve roots. Here, these are the posterior nerve roots and they lie posterior to that. So these channels are also connected by a plexus of veins which form a venous Vasoocrona. The blood from these veins drain into radicular veins which open into a venous plexus lying between the dura mater and the bony vertebral canal, which is, internal vertebral venous plexus, and through it into various segmental veins. Veins are valveless that permit bidirectional flow depending on the existing pressure gradients and body position. And it is a pathway for transmission of infectious agents and tumor cells, the metastasis. This is the enlarged form of the same picture, right? 1, 2, 3, 4, 6. These are the longitudinal running venous channels. So now a few clinicals related with the blood supply of the spinal cord. So first of all, of course, is the spinal cord ischemia. Considering the importance of the spinal cord, it is surprising that it has a meager blood supply. Blood supply is very small. The size of the posterior and anterior spinal artery is small and variable diameter, and the reinforcing segmental arteries also vary in size and number. Posterior 1/3 of the cord receives its arterial supply from the posterior spinal arteries, I've shown you already in the pictures. Anterior 2/3 of the cord receives its arterial supply from the small slender anterior spinal artery. Right? This lateral artery that supplies the anterior white column, the anterior gray horns, and the interior part of the lateral white column and the root of the posterior horn. You see in the picture, right? This is mentioned. This area, right? Of course, this I showed you the anterior spinal artery occlusion, right? This area with the shaded, the mauve area, it denotes region of the spinal cord affected. So this is the area supplied by the anterior spinal arteries. And here you see the cords mentioned, right? You see the, here would be the, the spinothalamic tract, right? And here is the corticospinal tracts, lateral and anterior. Here is the interior, this will be the lateral, and the spinothalamic tract. And here you see the spare tract. From this are the dorsal column system. You can see this from again. And also you see the affected area here is the, anterior columns of the gray matter, right? Anterior horns. When the anterior spinal artery is occluded, the following signs and symptoms may be produced. This whole spectrum is called anterior spinal artery syndrome, right? Occlusion of the anterior spinal artery. The signs and symptoms are loss of motor function, paraplegia below the level of the lesion takes place as there is bilateral damage to corticospinal tracts. Where are the corticospinal tracts? Here, lateral corticospinal tract, and here anterior corticospinal tract. These are showed you already much beautiful diagrams, discussion of the spinal cord. 15 lectures in whole. This would be the 16th is related to the spinal cord. So bilateral thermoanesthesia and analgesia takes place below the level of the lesion as there is a bilateral damage to the spinothalamic tracts, right? Here, this is the spinothalamic tract. This is the anterior, and it will be the lateral. And then number 3 is weakness of the limb muscles may take place as there is damage to anterior gray horns in cervical or lumbar regions of the cord, right? Where are they? Here, this is I'm talking about here, the damage to anterior gray horn cells. So loss of bladder and bowel control takes place, occurs due to damage of descending autonomic tracts. Position sense, light touch, and vibration are intact as there is preservation of dorsal columns which are supplied by posterior spinal arteries. So right, this is the preservation of the dorsal column, medial lemniscus system. So the sensations, life position, vibration, etc. related with that is preserved. So this area is not supplied by anterior spinal artery. This is supplied by posterior spinal arteries. So also the ischemia of the spinal cord often develops after minor damage to arterial supply as a consequence of nerve block procedures or aortic surgery or any surgical procedure in which severe hypotension takes place. T4 and L1 segments of cord are particularly vulnerable to ischemia. So then is the next clinical thoracic aortic dissection and spinal cord ischemia. Thoracic region of the spinal cord obtains its segmental arteries from posterior intercostal arteries, which takes origin directly from thoracic aorta. In thoracic aortic dissection, expanding blood clot in the wall of the aorta can block origin of the posterior intercostal arteries. That leads to ischemia of the spinal cord, right? And the spinal cord ischemia as a consequence of a leaking abdominal aortic aneurysm. Lumbar region of the spinal cord obtains its segmental arteries from lumbar arteries, which are branches of the abdominal artery, lumbar region, right? I showed in the picture already, this lumbar arteries, right? A leaking aneurysm putting direct pressure on the lumbar arteries can impede or stop the blood supply to the cord. So thank you very much for watching my video and listening to the lecture. I thank you very much again, and ask you to spread the message and share my lecture, and take care of you and stay safe. Like and comment my videos. Bye.